Amidst cancer's far-reaching effects across the nation, the launch of SC Spot by MUSC Hollings Cancer Center signifies a crucial and educated step forward. We are happy to be joined by Associate Professor of Public Health Sciences at MUSC Hollings Cancer Center, Kelly Sonawane. Kelly, thank you so much for joining us today. And can you tell us a little bit about this new tool?
Sure. So the MUSC Hollings Cancer Center has put together this wonderful resource where people from across the state can access important health-related data about their communities. A lot of times people have to rely on national level data or even state level data, and what's happening at national or state level may not be necessarily true for what's happening in their communities. So for instance, when you look at Williamsburg County or McCormick County, prostate cancer rates in those two counties are about 50 or 60% higher than what we are seeing at national level. So our goal was to put together a resource where people have access to local relatable health level data.
Okay, and now when did this program launch?
This was launched in March, so people can access this resource online. It's freely available, and it's been 2 months that it's been available now.
Wow, so now it's cancer-related data. So
Yes.
what does it all encompass when you go to this site?
Sure. So we cover important metrics related to cancer. So that includes new cases of cancer, cancer-related deaths, but we've gone beyond that. We've also tried to cover other factors that contribute to higher risk of cancer. So for instance, smoking, alcohol, cancer screenings. A lot of women are not receiving cancer screenings in our state, so we've tried to cover that data. In addition to that, we've also tried to cover determinants, what we call social determinants of health that shape our lives. So that includes information on, for instance, health insurance, how many people don't have health insurance in our state, or how many people have barriers such as not being able to have transportation to healthcare facilities or even access to healthcare facilities, for instance. So we've covered all this information and many more on the tool.
Yeah, and now is a tool like this, is this common practices in other states, or is this one of the first?
So I want to say that we are probably one of the very few states who have access to such rich community level information. There are maybe a handful of states out there who have built a community resource like this. So I can say proudly that we are probably like the top 4, top 5 states that have access to resource like that.
And now why is it so important for us to have access to this data?
Absolutely. So like I said, for us to be able to better advocate for our health, we need to understand what's happening at a local level in our communities, right? We cannot rely on what's happening at national level, what's happening at state level. By educating ourselves about what's happening in our community, we are able to understand what our unmet needs are, and we are able to come together and we are able to advocate for what we need.
And so obviously this tool is great for the people to have access to,
Yes.
but will Hollings Cancer Center be able to use this data for research purposes?
Absolutely. So we have our community advisory board, and we have a community outreach and engagement program. For instance, we have mobile vans, and what we are hoping for is, now that we know where the community needs are, we are able to send these vans. So we get more women screened for cancers, we get more people vaccinated against flu, we get more teenagers vaccinated with Tdap when they have to return to school. So we're really hoping that we're able to take this information, but also provide resources and generate resources and send those resources to these communities so we can improve their health.
And now where can people go and find this tool?
It's very easy to find. It is publicly available, freely available. All you have to do is go on a search engine and type HCC SC Spot. Again, it's HCC SC Spot, and you'll see our landing page. Once you click on that, you'll see all these wonderful pockets of information where you can either access cancer data or you can look at social determinants of health, like I said.
This is so wonderful. Well, Kelly, thank you so much for joining us and talking about this really important tool.
Thank you. It was a pleasure.
We're back in 2 minutes.